Can infections cause headache? Can COVID infection cause headaches? Hi, my name is Dr. Pravin Thomas. I'm a consultant and clinical lead in headache and interventional headache neurology services at Narayana Health, Bangalore. Yes, infections can cause headaches in multiple ways. Infections can be localized to the head and neck region, or it could be a systemic infection affecting the whole body. They all can present with headaches. COVID is also a systemic infection affecting different systems in the body, and COVID can present headaches at the time of infection and also what is called as a post-COVID headache, which can last for several months and even into years. There are people who have had COVID and not yet completely recovered as far as their headaches are concerned. Now, what are the kind of infections that commonly cause headaches? The most dangerous of those kind of headaches are meningitis, encephalitis, or meningoencephalitis. That is inflammation of the coverings of the brain or the brain substance itself. Now, we all know that some infections which can affect the teeth, the throat, the nose, they can all cause headaches. And one of the common causes of headache which people attribute is what is called as quote unquote sinus headache. Sinusitis is inflammation inside the sinuses, and the sinuses, as you know, is in the face. So you have the maxillary sinus here, the frontal sinus here. So when people have pain in this particular region and they have a bit of a stuffy nose, they are sometimes misdiagnosed as sinusitis, when sinusitis may not be the cause of the headache. The reason is migraine is a disease of the trigeminal system, which means that the trigeminal nerves of the face can also be involved. So a lot of people with migraine can have pains in the face and the mid-face region. And migraines can have autonomic symptoms, which means there's a bit of watering from the nose or stuffiness can happen. So this is the reason why there is often a diagnosis of sinusitis and patients are given antibiotics when it's not necessary. So it's important to understand that some of the what you call as sinus headaches are not really because of involvement of the sinuses, and they can happen purely because of migraine. Does that mean sinusitis does not cause headaches? No. If there is fever, if there is a thick, purulent, colored discharge like yellow or greenish discharge, then yes, you might be having acute sinusitis, which can trigger a migraine headaches, but not all of them. Similarly, if you take a scan and you find some abnormalities, the sinuses, because thickening of the coverings of the sinuses, people think that there is an active sinus problem going on. It may be a remnant of an old infection, including the x-rays. So it's sometimes very difficult, but it's important to differentiate because the treatments for both the conditions will be different. Other infections, viral infections, bacterial, fungal, they can all manifest with these headaches. In diabetics, there are fungal infections of the deeper parts of the nose, the sphenoid sinus, etc., which can cause headaches. It's important to identify in such people who have lowered immunity, such as diabetes, organ transplant patients, patients having immunosuppressed conditions, certain infections like HIV. They all tend to have these conditions which can reduce immunity and cause infections. It's important to identify and treat them. Thank you.